So I came across this video where this woman was taking the wife to a hospital in a car and was trying to tell her to be strong because of her children. She kept calling her name so that she would be able to respond. All right. In that video, what I noticed was that that lady was already going unconscious. She was semi-conscious. She was already going. Alright, that's what I noticed about that video. So, but the statement I saw there was that because the hospital asked him to deposit 500k for in order for them to admit the woman and do her surgery. So because he didn't have 500k, the hospital couldn't attend. So to cut the long story short, because of the admission, because of the 500k they didn't have, the hospital didn't admit them. The hospital referred them, and before they could get to where they were referred to, the woman died even before getting there. One thing I need to make clear about hospital admissions is this. You have to know that a private hospital is not government. There's no government individual or anything attached that sponsor private hospitals. Except maybe you have some hospitals attached to different firms or companies who maybe they send patients to you, you attend to them, then later the company pays you. But private hospitals who are not under such organizations, it is difficult for them to admit you without you paying some money. They will use that money to buy fuel. They will have to call an emergency team to attend to that woman. And then after that team is mobilized, as they go, you need to get drugs. And you know drugs now are on the high side. You have to pay the surgeon, you have to pay the anesthetist, you have to pay the pediatrician, and then the hospital has to get its own. And a private hospital, if it is that private hospital that gets maybe, let's say in a month, they get just 10 patients. They are specialized on only maybe minor issues, and then maybe a few surgeries in a month. They will have to buy diesel or fuel to run the clinic equipment and other things for your comfort. So my question is, if you don't pay the money, how do you think they run it? You get? How do you think they will even get the money to run all these things and then give you the attention you really want? Anyway, that's by the way. Another news came up that someone who worked in that hospital said after having accessed the lady, they even noticed that the lady has not been going for antenatal. And probably because she had already had 2 children, she felt like, okay, the 2 children were okay. There's no need to go to the hospital. When time comes, I would go and then deliver in any nearby hospital. She didn't know it would get to emergency. So the person who told the story from the hospital said they assessed this woman and found out that she had anemia, which is shortage of blood, severe one. Then pre-eclampsia. Eclampsia, because it wasn't. I'll conclude that it is eclampsia. Eclampsia because if convulsion is already setting in, the blood pressure is already increasing, the woman is already, getting to that bad stage where she was already getting unconscious, then it means the case was worse, and there's a time it will get that a private clinic will not be able to handle such things, especially if they don't have the team available to perform surgery on that woman or the necessary resources available to attend to that woman and her baby immediately. They would have to refer. You won't tell them to keep the woman there, of course. You can't tell them to keep the woman there because last, if anything happens, they will still blame the hospital. You knew that you could not do it. Why didn't you refer? Okay. So let's look at the story from both ends. Then if you are getting pregnant, if you're prepared that you want to get pregnant, and then you, the husband, what were you doing for 9 good months that you didn't prepare for any emergency? Because I'll always advise any young lady or any woman, any pregnant woman, whether you're depending on your husband or not, register somewhere. Look for a government hospital and register, even if you like private services, such that when, as you keep going for antenatal, if there's something going wrong, they will tell you, so that even if you cannot afford the bills in a private hospital, you will be able to do that in a government hospital. But at least try from the moment you know you are pregnant to save money in case of emergency. Don't allow it get to this point. Don't allow it get to the point where you will now become an emergency. They'll start carrying you from one place to the other. It doesn't make sense. For people blaming the hospital that the 500k was too much. If it is a government hospital, how much do you even think they charge for CS? How much do you think they charge for CS? Okay, even if they charge less, they have the government backs them up. A private hospital, they will have to stay in business, they will have to pay their staff, they will have to do so many things. How do you think they do those things? Una too, they charge too much. Una too, they do this. Una too, we pity people. People care about their birthday celebrations. They can throw a very big birthday, spend much money, buy clothes, more expensive clothes, but always run away from paying hospital bills. You run away from paying hospital bills, something that concerns your own life. It is your life. Something that concerns your life, you run away from paying money. If you can walk into a supermarket and they tell you this thing is 500, you don't argue, just give your ATM card, slot it in, and then you pay your money and go out. Why do we keep thinking the hospital is a charity organization? The drugs they get or they give you, you want the best from them. Do you think they also get it from charity? The hospital environment, if they are renting, how will they pay the rent? The staff they are employing, how much do you think they are supposed to pay the staff that is taking care of you? Because I don't get it. Why do people always want hospital to be a charity organization? Why? I'm not saying doctors or nurses should be heartless, but where do you think they get money from to do all those things? Because I don't get it. I'm not saying doctors should be exploitative or I don't know what language to use, but they shouldn't exploit patients. But as long as you want the best, because I'm sure even if you want to go into a business, you want to give in that business your best, you want to spend money to get good quality things. So if you need quality services, you need money to afford it. You need money. So why all this blaming hospital here and there, blaming hospital? I don't get it. Why wait for emergency? Why? If you cannot afford private, please go to government.